Good morning and welcome to In Touch. This morning we're talking with Dr. Puneet Sharma. He's a cardiologist with Sanford Aberdeen. We're going to be talking about their CorPath vascular robotic system, which helps heart patients. Good morning, Dr. Sharma. Thank you so much for joining us. So tell us about this new system.
This is a new technology to put stents in the hearts of the patient and came about in 2006. And few studies have been done on this, and FDA cleared it for human use in July 2012, and 6 of these machines are in US at present, and I would say the world, because they are not available outside US. And we bought one and have been working on this for last 3 months. It is available for all patients who come to our cath lab, and basically some of the risks involved with this procedure to both patient and the operator.
So this is quite an advancement for heart patients who need stents?
Yeah, it's an advance in the technology, and it takes some learning curve for this. The difference is that basically this robot is made up of 2 parts. One is a cockpit where actually we sit, and the other one is the robotic arm which we control with the cockpit. And initial part of the procedure, we just stand near the patient and we get the access into the artery. But rest of the parts where we put the wires in their arteries and then deploy the stents, that is done by the robot. Keep in mind that the arteries in the heart, they are about 3 to 4 millimeter in width. They are very small vessels. So with the robot, the precision of putting the wire in those arteries and deploying the stent, we can actually measure how much stent length is required. In the previous studies this have been done. Without this, generally studies have shown that you end up getting more stents than you would probably have if we would just measure it and deploy the stent in the precisely how the patient needs it. And the second thing is that this has shown that it has reduced the X-ray exposure to both patient and the doctor. And as you know, the X-ray exposure is cause for cancer, cataracts, and also can result in skin burns. So it's beneficial for both. And then second benefit is that we are sitting right next to the monitors and get better pictures that way. And it reduces the contrast that we inject to take pictures. And the contrast is generally not good for the kidneys for the patient. So studies have shown that it has reduced both of those harmful effects of radiation as well as contrast. The robot so far has been used for patients who have been stable with angina, like they are walking stable patients and they start having angina, which is kind of milder form of heart attack, but these patients are stable. And most of the studies have been done on those patients, and they are brought electively to the cath lab and then they have done interventions on them.
You're listening to In Touch, and we'll be back in just a moment. Welcome back to In Touch. This morning we're talking with Dr. Puneet Sharma. He's a cardiologist with Sanford Aberdeen. And we're talking about their CorPath 200 robotic-assisted system, which was recently installed at Sanford Aberdeen Medical Center. Dr. Sharma has utilized the vascular robotic system with an acute heart attack patient.
We placed the stent in the artery of the heart in a patient who was actively having a heart attack. So nationwide, our goal for doing intervention in patients who come with the heart attack is 90 minutes door to balloon time. Generally, we are able to do that in that span of time, and that is considered a critical time after a heart attack. Using the robot, we were able to do it in 68 minutes, and that is within the national standards. But if we were to do it with hands also, it still would be within that time. But it is just to show that robot is good for patients who are stable as well as unstable. It doesn't increase your time. We were able to achieve it within a normal time frame, and just happens to be the first instance of using the robot to place stent in heart in patients who is having a heart attack.
How did Sanford Aberdeen Medical Center receive this robotic arm?
It is a research grant that we got from Helmsley Trust, and Sanford has a collaboration with them, and they were giving a research grant, and Sanford is employing the recent technologies and giving it to this area also. So it's part of that. They bought 2 machines. One of them was in Sioux Falls and one of them is with us. This technology is still evolving, and we will keep on advancing this technology. I think significantly reducing the patient's risk of X-ray exposure and contrast, and precisely deploying the stents in the arteries and with the good control of the wires and balloons and stents. I think this technology is here to stay, and it prolongs the life of doctors also. If you think that we are working in that atmosphere all the time, exposed to x-rays, and studies have shown that it is good for both decision making also, because you are sitting in the cockpit with all the monitors in front of you. The decision making for doctors is also better, just because when we do these procedures, we are wearing those leads that are too heavy, and sometimes these procedures stretch for 2-3 hours. So chances of getting tired with this are less, and that doesn't affect your decision making capacity. The amazing thing is that the hospital is bringing all these resources to this small town. And if you think about it, after you start having a heart attack, you have a 90-minute window. If you restore the blood supply to the heart, you can prevent damage to the heart muscle and prevent death also. So the longer you are from an interventional place where you can get the interventions done, more it increases chances of morbidity and mortality. So having a place here where we are serving the neighboring areas also, and being able to achieve it in a timely fashion, and now using the newest technologies, I think it is beneficial to the community.
That's going to do it for today's edition of In Touch, a locally produced feature of Dakota Broadcasting Radio. I'm Marna Lee.